Hello, and thank you for joining the Muscadine Education Conference as part of the 2021 Virtual Southeast Regional Fruit and Vegetable Conference. I'm Patrick Connor, a professor with the Horticulture Department at the University of Georgia, and I'm going to be your moderator for this presentation. Pesticide CEU and CCA credits are available for most presentations offered during the live Southeast Regional Conference. Check the Pesticide CEU guide for a list of approved presentations and participating states. The Pesticide CEU guide is located at the Event Resources tab under the Media Player. The guide is also available at the Resources Center located on the main menu of the conference platform. Please note, pesticide credits will be available only for registered attendees and only during the live conference. Credits will not be available for on-demand viewing. There's a simple three-step process to receive pesticide CEU and CCA credits. First, go to the audience chat box located on the left side of your screen and type your first name, last name, and the states for which you're requesting credits. Again, go to the audience chat box and just type your first name, last name, and the states for which you're requesting credits. You'll need to do this for every presentation to request CEU credits. The second step is to sign out at the end of the presentation. To sign out, go to the audience chat box and again, type your first name, last name, and the states for which you're requesting credits. I'll remind you at the end of the presentation to sign out. The third step is to complete the pesticide CEU registration. You only have to do this one time during the conference. This is not required with each presentation. To access the pesticide CEU registration web link, open the pesticide CEU guide on the Event Resources tab located under the Media Player. The pesticide CEU registration web link is located on the front cover of the guide. This presentation is pre-recorded to reduce technical, this presentation is actually going to be live this time. You can submit a question at any point during the presentation by typing your question in the questions box and pressing send, and we'll answer those questions at the end of the conference. Don't forget to thank our 2021 conference sponsors and exhibitors by visiting the virtual trade show and featured products pavilion. And lastly, don't forget to join us each morning for coffee chats and each evening for networking. Check the conference agenda for details. Now, I'm going to like to introduce our speaker. Is Dr. Patricia Gallagher, who is a professor with Wake Forest University. He's going to be presenting muscadine grape extract, just a supplement or a potential therapeutic. As we all know, fresh fruits and vegetables have a lot of important nutritional benefits. However, muscadine in particular has a bounty of important phytochemicals. Patricia's talk is going to go over some of the latest research into these chemicals and how they may impact human health. There. Okay, Patricia, if you can want to go ahead and start your presentation.
Thank you, Patrick, and the meeting organizers for the opportunity to share our work. Our project focuses on the use of a muscadine grape extract, not as a dietary supplement, but as a treatment for cancer and chronic disease. I'm not sure I can change these. There we go. Why muscadine grape extract? As Patrick said, muscadine grapes contain particularly high concentrations of compounds called dietary polyphenols. Polyphenols are highly complex micronutrients found in plants that provide multiple health benefits, including effects on cancer, diabetes, inflammation, and cardiovascular disease. The highest concentration of these helpful phytonutrients are found in the skins and seeds, and muscadine grapes have a thick skin with multiple large seeds, and often this is the part that you throw away. I'm sorry, I'm having, there we go. This is a $20 million donor-funded initiative involving over 25 investigators at Wake Forest University School of Medicine. This multidisciplinary approach allows us to quickly implement the discoveries made at the lab bench to clinical trials in patients. Now, due to time constraints, I can only highlight some of the major findings today. The muscadine grape extract that we're using is a new proprietary extract produced by Piedmont Research Corporation of Advance, North Carolina. As you can see in this graph, this extract, represented by the yellow bar, has a higher concentration of dietary polyphenols than the muscadine grape extracts currently on the market. We're often asked, well, slide's not coming up. Okay, so we're often asked if muscadine wine has sufficiently high levels of dietary polyphenols to be used as a therapeutic. The graphs to the left show concentration of polyphenols in white and red muscadine wine from 4 different North Carolina wineries. Unfortunately, the math that we did on isn't showing up on the slide, but we calculated you would have to drink more than 2 bottles of white and 1 bottle of the red muscadine wine per day to ingest the equivalent dose of dietary polyphenols we use to treat our patients. So while muscadine wine is a tasty option at times, it's not going to be a therapeutic one. So using this novel proprietary product, one question we asked is whether our muscadine grape extract had an effect on the growth of tumors. In this experiment, human breast cancer cells were injected into the breast tissue of female mice, or human prostate cancer cells were injected into the flank of male mice. Once the tumors reached about 100 millimeters cubed, so that's about the size of a pea, the animals were given the muscadine grape extract in their drinking water, and tumor size was measured once a week. The yellow bar in both graphs represent prostate or breast tumor growth in mice just drinking water. The muscadine grape extract, as you can see, given at increasing concentrations, significantly reduced breast and prostate tumor growth, as you see in the purple bars. The amount of extract we gave these mice was equivalent to the doses administered to our patients in clinical trials, so not a ridiculously high dose as often happens. And I'll talk about these clinical trials a bit later. So these data suggest that the extract may serve as an effective anti-cancer agent by decreasing tumor growth. Using animal models, we also found that the muscadine grape extract prevented cancer formation, and combining the extract with standard of care drugs caused an enhanced reduction in tumor growth compared to either agent alone. Unfortunately, time does not permit me to share this data with you. Now, because there are a number of available cancer drugs to treat breast and prostate cancer, the 5-year survival rate is over 90% if you detect it early enough. Unfortunately, that's not the case if the cancer has metastasized to a distant site in the body. The majority of drugs developed to treat primary tumors have little or no effect on metastases. So we asked the question whether the muscadine grape extract could reduce metastasis. To test this, human breast cancer cells were injected into the breast tissue of mice. After 2 weeks, the primary tumors were surgically removed, similar to the surgical intervention that a woman would have if she had breast cancer. One set of animals were given regular drinking water. The other set received muscadine grape extract. After 4 weeks of treatment, the livers of the mice were examined for metastases. So as you can see in the graph on the right, the number of metastatic tumors were markedly reduced in mice drinking muscadine grape extract, abbreviated MGE in the graph on the purple bar, as compared to the control animals receiving drinking water, the one in the yellow bar. So taken together, our data suggests that our muscadine grape extract may serve as an effective agent to reduce tumor metastases. Now, while many of the newest targeted therapies effectively reduce cancer growth, we're beginning to realize there's a price to pay. Many of these drugs cause damage to the heart. In this next study, we tested whether the muscadine grape extract could prevent heart damage induced by trastuzumab. This is a monoclonal antibody used to treat a particular type of breast cancer. Unfortunately, women taking this drug develop heart damage. The mice with breast tumors were divided into 4 groups, either untreated, or they received muscadine grape extract in their drinking water, or were administered trastuzumab, or a combination of muscadine grape extract and trastuzumab. After 3 weeks, the mice were analyzed by echocardiography to assess their heart function, just as you would if you went to your cardiologist. As you can see in this slide, trastuzumab, represented by the blue bar, caused a decrease in all 3 measures of cardiac function after only 3 weeks of exposure. Muscadine grape extract given with trastuzumab prevented the heart damage, as shown in the green bar. These results suggest that the muscadine grape extract may be an effective additive to prevent heart damage caused by chemotherapeutics to improve their safety profile of these cancer drugs. Now, it may surprise some of you that only about 30% of the cells in your body are human. The remainder are primarily bacteria, collectively called your microbiome. The bacteria in your gut break down the food you eat to produce a wide variety of molecules. A healthy microbiome has positive effects, while an unhealthy collection of bacteria can promote disease. We're interested in whether the dietary polyphenols in the muscadine grape extract alters the bacteria found in the gut to produce a more healthy microbiome. To answer this, we fed normal mice the muscadine grape extract for 30 days and then analyzed the bacteria in their feces. The bacteria in the mouse poop is reflective of the bacteria in the gut. First, we looked at how many different kinds of bacteria were in the feces. Studies show the more diverse the bacterial population, the healthier it is. As you can see in the graph on the left, the poop in the mice drinking the muscadine grape extract, the purple squares, had more different kinds of bacteria than the feces of the mice drinking water. We also found the muscadine grape extract altered the concentrations of certain bacteria. For example, the ratio of the firmicutes to the Bacteroidetes was changed in the feces of mice drinking the muscadine grape extract as compared to the poop from the water drinking mice. Now, why in the world is this important? Studies show that the higher the ratio of these 2 bacteria, the greater the energy harvest you receive from the food you ingest. These data suggest that the muscadine grape extract may be an effective probiotic to improve gut health. So besides cancer, we wanted to know if the muscadine grape extract had an effect on chronic disease, specifically hypertension or high blood pressure. In this study, male rats were divided into 4 groups, either untreated, they received muscadine grape extract in their drinking water, or one group was administered a hormone, Ang2, to increase their blood pressure, or a combination of muscadine grape extract and Ang2. Blood pressure was measurements were taken every week, and the mice were analyzed by echocardiography to assess their heart function, just as if you went to your cardiologist. First, we found that the muscadine grape extract had no effect on blood pressure, but it did improve heart damage caused by high blood pressure. As you can see in the graph on the left, represented by the orange bar, the hormone Ang2 that increased blood pressure also caused an increase in the pressure required to fill the heart. And this causes heart damage. The muscadine grape extract given with Ang2 prevented this damage to the heart function, as shown by the purple bar. Further, we found that Ang2 caused an increase in scar tissue in the heart, as shown by the stained red fibers in the picture on the right and quantified by the orange bar in the graph. Treatment with muscadine grape extract reduced the amount of scar tissue produced by Ang2. These data suggest that the muscadine grape extract may prevent heart damage caused by hypertension. Lastly, in our animal experiments, we asked whether the muscadine grape extract improved exercise capacity. In this study, the rats are genetically engineered to get hypertension, and they were given the extract in their drinking water. All they did was drink the extract for about 26 weeks, after which we exercised them on a treadmill. Yes, we have a treadmill for rats to run on. And there you can see in the picture in the upper left-hand corner of the rats running on a treadmill. We found that drinking the muscadine grape extract improved exercise capacity and workload about 2.5-fold in aged hypertensive female rats, as shown in the purple bars on the right in the graphs, as compared to the rats drinking water alone in the yellow bar, suggesting that the extract could improve physical function. By contrast, though, you see in the bottom graph, there was no improvement in the male rats. We furthered this study, looked at giving them 56 weeks of extract, and still nothing with the male rats. We don't know why. So we're continuing to investigate this. So to summarize, I've shown you that in our animal data, we found that muscadine grape extract reduced cancer formation, growth, and metastases, enhanced current cancer treatments, improved the microbiome, prevented heart damage, and enhanced exercise capacity. So these results have actually provided the basis for our clinical trials. In our completed phase 1 clinical trial, we assessed toxicity of the muscadine grape extract in patients with solid tumors. The extract was administered twice a day, and 3 patients received either 2, 4, 6, 8, or 10 pills a day. The mean average of enrollment of these patients was 72 years old, older than the majority of patients you normally find in a phase 1 trial. Doctors had treated these patients with all measures of standard of care and experimental therapy. The majority of these patients were hospice eligible. We found that 6 of 18 patients, as you can see in the graph, taking the muscadine grape extract had stable disease. Their tumors did not progress for 5 months or longer. 1 patient remained on study for over 2 years without tumor progression. As a plus, the patients experienced none or limited side effects. In this trial, the patients self-reported improvements in physical function with increasing dose of the muscadine grape extract, as seen in the graph on the right, on the left. And they also showed a decrease in fatigue, as shown in the graph on the right. These results suggest that our proprietary muscadine grape extract may be effective in improving quality of life issues due to disease or therapy. So currently, we are running a phase 2 clinical trial in men who are being treated with androgen deprivation drugs after surgical removal of their prostate tube. The primary endpoint is metastasis-free survival, with a secondary endpoint of improved quality of life, as men taking this type of chemotherapeutic exhibit fatigue, cognitive impairment, and brittle bones. A second clinical trial is ongoing It was recently funded and just began in this last month, and it's to assess the effect of the extract on fatigue in older cancer survivors. So in the future, besides these 2 studies we're running right now, we would like to assess the effect of the muscadine grape extract on patients with leukemia, with colon cancer, with lung cancer. Further, we want to continue our studies in fatigue and look at a normal elderly population to see if we can use the extract to get them off the couch and get them back exercising. And also look at improvement of fatigue in radiation-treated patients. We also want to see if we can restore the microbiome in cancer patients where their bacteria in their gut have been destroyed by harsh chemotherapeutics. And finally, we want to look to see whether we can use this as an adjuvant to prevent cardiac toxicity, heart damage in patients that are taking these chemotherapeutics that can cause loss of heart function. So with that, I'd like to thank you for your attention.
Thank you, Patricia. We're going to answer some questions now from the audience. If you have a question, type it into the chat box and hit send. And also as a reminder, if you're requesting pesticide credits from this presentation, don't forget to sign out. Just go to the audience chat box and again, type your first name, last name, and the states for which you're requesting credits. We'll give a few minutes here to see if anybody has a question.
Well, this talk is probably a little out of the norm for your group. We don't have any pesticides here.
Yeah, one question I had, Patricia, do you know what part of the grape is primarily in the extract? Is it seeds or skin or both?
This is all seeds and skins.
Seeds and skin, okay.
No pulp, yeah. The pulp is separated and used to make juice.
Okay, so it would be kind of a secondary use for after you've juiced the grapes, then you could use them to make the extract.
Yeah, so the seeds and skins are ground and then they're redissolved in water and then subjected to a process that's called a film spray, similar to a process you use to dry milk. And in that way, we can get a much more concentrated selection of polyphenols than you do in just ground seeds and skins. So it's only those polyphenols that are actively soluble in water that you'll find in our extract. So something like resveratrol is not there because it is not readily soluble in water.
Okay. Do you have any information on when they are looking to go forward with this in terms of, I suppose that's probably pretty tight to the vest, but.
Well, in my opinion, they could go now if they wanted to market it, say, as a medicinal food, where you don't have to go through phase 3 trials as you would if you want to market it as a botanical drug. It's not my product, so it's not my say, but and we've got a bit more work we want to do with it. So I think the paper on the phase 1 trial should be coming out soon. They may be waiting for that. They may be waiting for the results of some of these phase 2 trials.
Okay, we got a couple questions here. First, when I eat muscadines, I usually spit the seeds and skins out. Should I be eating those?
Well, that's where all the action is, really. But I will tell you, I've made that mistake and eaten a bunch of the skins, and I was sick. So, no, I don't recommend you do that.
Was there a particular variety used for the study or just black muscadine in general? Or
these are primarily Carlos variety.
Okay. And again, the third question, again, I think was asking about the variety used in it. All right, it looks like that's all our questions. So we're going to wrap this up. Thank all the attendees for attending the presentation. Don't forget to sign out for your pesticide credits in the audience chat box. All educational presentations and a virtual trade show are going to be available to access until April 30th, 2021. So come back if you missed a presentation or just want to rewatch one, or if you need to search for a service or product in the virtual trade show. Again, Patricia, thank you for your participation, and this concludes our presentation.
Thanks, Patrick. Everybody have a good meeting.
All right.